Hello, can everybody hear me?
Yes, we can.
Hello. Okay. So, welcome everyone. Greetings, first of all. Good evening. Here it's evening time, Maghrib time. I don't know from which place you people are from different areas in Pakistan and India. It's the evening time, but in other parts of the world, if you're from far away, then good morning or good afternoon. Anyways, welcome to this webinar today. So, I think shall we start or we shall wait for other people to join? Maybe 2 minutes we can wait and then we'll start. Okay. Maybe some more people will join. Okay. Can you see the screen, doctor?
Yes, yes.
Yes.
Okay. Yeah. So I'm Khawar and I will be seeing you more often in the OSCE and as well as in the written live sessions. And also I will keep an eye on all of you on the OSCE Telegram group as well. Okay. Those who have joined already, they are familiar with me. So I'm working as OB/GYN consultant in Riyadh at Suleiman Al Habib and Dr. Suleiman Al Habib Hospital. So you start introducing yourself one by one, and also tell me from where you are speaking and which exam are you preparing for, written or OSCE, which session are you preparing for. Okay, a quick brief introduction. We'll start one by one. So Ibrahim Kasser is here with us.
Yes, yes, I'm here.
Yes. Okay. Tell us about yourself. How are you doing?
Fine, fine. Alhamdulillah.
Yes, yes, Dr. Ibrahim.
Uh,
Brief introduction about yourself.
I'm Ibrahim Talat. I'm a organic consultant in MSH Egyptian.
Okay,
Uh,
welcome.
I Thank you. I cleared part two about 3 months ago, and I am still
Mhm.
hesitating to join February or May OSCE.
Okay, okay.
But I just finished the MRCOG Part 3 exam.
Okay,
My cause of
nice.
hesitation to I'm thinking to wait for May, but I'm afraid I may lose the information I gathered for part 3 RCOG in this long distance.
I think you still have time for to apply for a February exam, no? 26 November is probably the last date, no? Okay. Dr. Fasia, unmute yourself. Hello, Dr. Fasia is there? Dr. Martin?
Okay. Hi,
Yes, okay.
everyone. Yes,
Hi.
I'm Dr. Martin Obi-Gyne consultant. I'm a Nigerian. I work in Saudi Arabia, Alba region, with Al
Okay,
Muqaddaran Hospital.
okay.
I
Nice,
MRCOG written.
nice.
Yes,
So you're
MRCPI
preparing,
for written,
you're
written.
preparing for written exam. Okay,
Yes,
this will be
it's in
upcoming
March.
exam in March. Yeah.
Yes,
Okay.
yes.
Okay. Welcome, Dr. Martin. So, Abira, Dr. Abira, who else is there?
Uh, Hello.
Yes.
Hello, Assalamu alaikum ji. I'm Dr.
Walaikum
Abira
assalam.
and I'm from Peshawar, Pakistan, and I have done with my FCPS and I'm planning to appear in MRCPI OPS-GYN in March, inshallah.
Okay. Welcome to the group. Next, we have
Thank you.
Dr. Husni. Hello. Dr. Husni, are you there? Archangrawal, if I'm pronouncing your name right. Hello. Hello, Dr. Mariam, Dr. Nahid, Dr. Isra. Welcome all
Assalamu
of you.
alaikum. I am
Walaikum
Dr.
assalam,
Nahid
Dr.
and I am
Nahid.
from Islamabad and I have done FCPS Gynae Ops and also MRCPI written in September 2025. I got I passed going to appear in MRCPI OSCE in Feb inshallah.
Yeah, okay, inshallah. Welcome. Dr. Isra, one by one, please introduce yourself. You can also open your video.
Assalamu alaikum. Yes.
Walaikum assalam. Yeah.
Uh, yes, Doctora. Hi, I am Dr. Isra. I am OB-GYN specialist. I'm prepared in Saudi, Medina. I am preparing for MRCPI paper, inshallah, on March.
Okay, inshallah, bismillah. Um, who else is with us? Dr. Anam Rashid is from backup team or a candidate? I'm not sure. Please introduce yourself. Hello? Yes?
Hello.
Yeah?
Hello. Assalamu alaikum. I'm Dr.
Walaikum
Taiba. I'm
assalam.
in obstetrics and gynecology. Currently, I'm working in Gilgit, Baltistan, Pakistan. And
Hello? I think we lost the connection. Hello?
hello, madam.
Dr.
Can you hear me?
Yes, yes, we can hear you now, Dr. Taiba. I think because you're from long distance, there is a lag in between. Yeah,
Yeah, I think.
continue. Yeah, okay. Which exam are you taking?
So I'm taking MRCPI, inshallah, in February. I passed
Okay.
my written exam in 2023 September, but it took me a long
Yeah.
time to go for OSCE. So this is my first time that I'll be doing in February, inshallah.
Inshallah. This will be your first and last time you will be through, inshallah. Okay.
Inshallah.
Just stay
Thank
glued
you.
to our program. And I wonder
Thank
if
you
you
so much.
joined the Telegram group or no. I don't see you there. OSCE Telegram group
Uh,
already
yes,
for the last week.
yes.
Hmm?
I joined recently. But unfortunately, I was so busy in some kind of training
Mm,
in my area. I could not
yeah.
participate in discussion. Yeah.
Okay, right. Who else is left? Anybody who's left, please quickly introduce yourself and then we will start.
Okay, Madam, Assalamu alaikum. I am Dr.
Yes,
Anam Rashid
Walaikum
from
assalam.
Peshawar.
Yes,
Dr.
Dr.
Anam
Anna.
Rashid from
Welcome.
Peshawar, and I am planning to appear in MRCPI OSCE in May, inshallah.
Okay, right.
Hello,
So
hello,
welcome
Dr.
all of,
Sorry.
sorry.
Hello,
Hello,
Dr. How are
yes.
you? I'm Dr.
Hi.
Hosni Abu Zain. I passed my MRCOG part 2 last session. I'm preparing for MRCP written exam in March, inshallah.
Yeah,
Yeah,
okay.
yeah, thank you.
Welcome and congratulations for passing your written exam and
Thank
good
you.
luck for your future exam as well, okay?
Thank you.
Hello, I am Dr. Shayma
Yes.
from Libya. I just passed my MRCPI written in September and I just
Okay.
finished my MRCOG part 3. I hope to pass and I will go for the OSCE inshallah in February.
Okay, right. Okay. So a very warm welcome once again to all of you. And I'm so delightful, so happy that you have joined out of your busy schedules. So this is a brief introduction of the, I wonder if you can see the screen, all of you? Not yet? Oh.
Yes.
Hello, ma'am. Your screen.
No, you can see the slides as well or no?
Yes.
Yes.
You can see full screen? Is it okay? Is it
Yes.
clear, the slide for all of you?
Is
First slide.
Yes,
is
please.
Yes, it's clear.
It's clear, right? Okay,
yes.
Yeah.
fine. Okay, thank you. So this is about 1 second because I can't see. Where is this? I shall also be able to see the screen. 100. Don't know what has happened to this today. Okay. So anyways, this webinar has been arranged to give you introduction about the course, about how to prepare for the exam, some information which you already know about the structure of the exams and how we are going to work as a team to help you out and to succeed in your aims and to achieve your targets. Okay. And so all of you can see. So you can see the pyramid in the first slide. Hello.
Yes, we can see.
Yes,
Yes,
You
please.
can see. So what do you see in this pyramid? Who will tell me?
Persistence, focus, and
Hmm?
So
discipline
this
leads to
pyramid
success.
shows that success is actually a component of three factors. First of all,
Yeah.
discipline, and then persistence and focus.
Yeah. Yes. So this I want you to remember that if for any to achieve any target, whether it is in success in your business, in your study, post-graduation program, consistency is very important. That be consistent and stay focused. And discipline means that you should organize yourself. I know most of us, we are busy. We have families, we have kids, we have job, so many commitments at one time, relationships, right? So you just make a timetable. If you have already made, it's good. If not, then this will really help you to organize yourself to how to go about the your preparation for the exam, because now time is just uh, not too much time we have. We just have the sufficient time. I must say only 2.5 months for the OSCE and 3 months mm, for the exam preparation. I'm sorry for the interruption because something I did wrong. I cannot move the further slide. 1 second. There is something. Initially it was okay. Why I can't see full screen? Discipline, successful person, persistence. Let me start again. 1 second. Yeah, now it's okay, right? Okay. So, what are the objectives for today's session? That this is the MedExamExpert is like for the last few years have been a very successful program for the coaching for various exams. So our aim is here to give you a real feel of the exam. All the courses are oriented towards the exam pattern. Okay, so we focus on your learning with reasoning and to empower not only for the exam but also when you study the basic things of. I should not click on my photo. What happened? You should. It will also improve your clinical approach. Mm, I'm so sorry. What's happening to me? Need to stop and restart. Mhm.
Hello, ma'am. Can you please check your WhatsApp?
Yeah, I will check my WhatsApp. And now it's okay, I think. But we cannot have like full screen view. I will check my WhatsApp. Mhm. I think it was okay the other way. 1 second. Now it's okay. It's okay, guys. Can you see? Oh, so just give me a minute to restart sharing. 1 second, just give me a moment. I will zoom in again, okay? I'm sorry for the interruption. Need to minimize this. I think I will leave meeting for a second and then I will zoom in again, okay? Oh, man.
Hello everyone. Dr. Khawar is back. She's trying to uh, share her screen.
Hello?
Hello,
Hello,
Dr.
guys, can you
Yes.
hear me?
Yes, we
Okay,
can.
Yes,
sorry.
madam.
I'm so sorry for the interruption. So we were here. I was telling you about about the MedExam expert, what we are focusing on. So this is all the syllabus is according to your requirements, and it is divided into different courses. Like we have a OSCE group, we have Telegram groups, and also you have lots of support material on the website. Okay, so there will be schedule will be shared with you guys for the live sessions, both for the OSCE and for the written exam. So here I've given you a brief overview. Can you see the whole slide? So there will be live sessions. We will be starting for the written exam on 28th of November until February 11th. So those who are preparing for March, you will have sufficient time to do your quick revision. But I would suggest that follow the schedule of the live sessions, prepare your module wise, it is all organized according to the module. So do your revision just before the session because already the whole program calendar will be with you. So take out time to follow this. Also, there is a Telegram daily practice group which is already run by Dr. Musarrat. She was supposed to join us today. Maybe she will join in a while. So she has already started. So please participate actively because this will benefit you. Okay. The more you practice for it, it is better. Then similarly for the OSCE exam, we will start on inshallah 26th of November, the live session until 23rd January. So there will be long cases and also we'll do the OSCE practice. Already there is a Telegram group which I am running, and I have started posting from today 2 sessions, 2 case scenarios daily. I see most of the people, they are not, I can understand that there is workload and you don't have time, but this is the time, please avail it. Whether day, night, whatever, find out some time, maybe half an hour, 30 minutes or 1 hour at least, to whatever. See, at this forum, you can make as many mistakes, so there is no need to be embarrassed or shy because we all are the same. Okay, so we learn by practice, and that is why we have this coaching program. So here there's a time that you can correct your mistakes, learn from your mistakes, learn from your colleagues, listen to others colleagues audios as well, listen to the feedback. Okay, so, and I would collectively, if you will, those who will post the audios on the same day, I will give them feedback on the same day. And if not, then I will give a collective feedback. Okay, so individual feedback is also there for you to guide. And also there's another side-by-side Telegram group, which is for the study material. So whatever topic I'm posting, I'm also posting the study material. So please go through this. This will save your time. You don't have to go to the websites to search for the materials on MRCPI website or others. Okay. Anything you want, you can just text or you can write on the Telegram group. So regarding the website, MedExamExpert website, you all have access, those who have subscribed. So you can find the guidelines, the recorded sessions 24/7, they are there for you. So whether you are working, you are busy in some other household chores like this, so you can listen to the audios as well. This will also help you. In the end, we'll have a mock exam as well for the OSCE. So I hope this will help you all. So this is about the course structure. So it is module based and we will have live sessions. There will be recordings available for you. There will be mock exams as well. So the more you practice, the more you gain. And also there are 3 mentors, me, Dr. Shazia Maqsood, very well known to all of you, I'm sure, and myself and Dr. Musarat will be helping you throughout the course. Okay, so we are always all the time available. Anytime you can just message. It doesn't mean that you start to call, but don't feel shy. Any queries? Today also in the end, I will take some question answer sessions we will do. So write in the chat box, what are you struggling with the time management, with the recall content, with the SBS. Okay. So we will try to find a solution in the end. Now, a little bit information regarding the exam structure you all know already, but still I thought maybe it will be helpful for you. So this, what are the benefits? This is a membership exam which has an international recognition. So you will have an opportunity, those who want to plan to settle in Ireland or find work experience there. This will also help you with the GMC registration. And also, I think the most important thing is that you have a self confidence, and also it gives you a self satisfaction, a satisfaction of achievement, which is a great opportunity and a great feeling once you have achieved your target. So be proud of yourself. You have reached up till here, and inshallah, Allah will help you to succeed and reach to your goals. So part 2 written exam is based on 100 SPA questions. It is a 3-hour exam. You all must be familiar that it is done remotely. It is taken. So from your home you can do. But before the exam, make sure that you have, once your seat is confirmed, make sure that you have the access to a good internet connection, because some technical errors cause anxiety. So this, you should fix all your things. You should have a backup. So during the exam, while the exam is ongoing, you don't have any problem. Okay. So it is based on single best answers. There is no negative marking in the exam. And believe me, it is a very doable exam, especially those who are working. I can see many of you are consultants. So it is just based on there will be clinical scenarios, and it is just based on your daily practice. But of course, we need to practice, because sometimes some figures can come, some things we all tend to forget. So practice is very important. Um, so for part 2, you have already must have this familiar. It's all information is given on the website, but I just added here for your ease. So you can see that part 2 written exam will be on 5th of March, and it's done remotely. The opening for the applications will be on 3rd of December. Okay. So prepare your things before that. If you have to apply for the eligibility assessment, do that, and also organize your leave from your departments, because December, January is holiday season, right? And we will be expecting your results on April 26th. So similarly, for now about the OSCE, those who are appearing in OSCE, there will be one long station, a long case discussion with the examiner and with the role player most likely. And this can be either obstetric case or a gynae case. It's your luck. In this examination, actually, this is very important that you are very good in your examination, because in examining the patient. So what will happen, that you will introduce yourself, and then there will be role players. So task will be given. So you will first take the history from the role player, and then you have to examine on the dummy. So there will be one examiner observing you for your examination skills and marking you. And then you come back, the examiner, there might be 2 or 3 examiners in the long case. So the examiner will then give you the examination findings, and then you explain the findings to the patient and explain the further management plan. And then in the end, the examiner also has some questions to ask you. Clear? So OSCE is of 7 stations. It's written on the website. There is resting station. Sometimes there is a rest station. Sometimes there is no rest station. So there are 7 stations, out of which one will be definitely labor ward prioritization. So we will do, inshallah, practice for the labor ward prioritization separately in the end of the course. And the rest of the 6 OSCE stations will have one role player station for counseling. This can be either IUFD or some anomaly, or telling the breaking bad news for some malignancy. So that is why Telegram OSCE practice is very, very important. Okay, this will polish you, and inshallah you will pass with flying colors. And we want you to see all of you pass first time. So this is about the OSCE exam. We all know you must have all applied for this one. So there is OSCE exam in February, will be in Dubai, UAE, and all you still have time to apply. Those who are just indecisive, 26 November is the last date to apply. And then in May, it will be in Ireland. And also internationally, it will be held, but they have not yet decided the venues. And in November also, it will be in Ireland and international at international centers as well. So now a little bit about your study plan. So if you please find a study buddy. If you don't have, find someone, either your colleague, friend, online, wherever, pair up. So this will be easier for you. And also set your goals, weekly targets. You can plan it, make a timetable, like divide the course for those who are preparing for the written exam. I would say that if you don't have, you can access from the website, or you can let Dr. Musarat know, so she can share with you the PDF folders for the OSCE practice books. So SBS single best answers you can do from the MRCOD3 books, because MRCPI doesn't have their separate practice books, or also from the recons. So practice at least 15 to 20 questions daily, or 10 to 15, if not 15 to 20. And then according to the schedule which will follow, prepare module wise as well. So practicing will, because many questions are repeated in different books, so more you practice, you will have good grip on the subject. And also then keep 2 days for the revision. For example, 5 days in the week you can practice, and 2 days you can, before the session, you can revise the module according to the module. Okay. Also during the day, at least 2 hours, 2 to 3 hours from now, try to spare time for your study, and whatever you study, then you revise it, because multiple revisions make you then perfect. So I just made a small plan for you, that consistency beats intensity, means that you should be consistent in your practice. Make a target, make timetable. If you want any help, you can ask, you can share your timetables, that this is the timetable, ma'am, and can you tell me? Or if you have a busy schedule, you can scale your schedule, then we can discuss how you can find out time, because you have goals. And so you have to make your planner how you are going to achieve those goals. Okay. And we are here to help you. All the team of MedExamExpert is here. All the mentors are here with you 24/7. So don't skip the sessions. You will have the timetable already. Maybe the team have shared, because recently we had some changes. So adjust your duties according to that, so that you are able to attend. Although there will be recordings, but if you attend live sessions, this will have an opportunity for you to present, especially those who are going for OSCE. Okay. So participate actively on Telegram groups. This is very important. There is very little participation we see both in the written and the OSCE group. So I would encourage all of you again and again. I'm telling you, this will really help you. Okay. And because time passes very fast. See, I will cover almost 100, maybe around 100 recalls we will cover for the OSCE, and long case sessions we will do in the live sessions, which I will take. I will prefer doing 25-minute session with it, so that each one of you gets an opportunity to present a long case. All right. So follow the 50-30-20 rule, which means 50% time will be for your learning, then 30% you should practice, and 20% you should revise. So 5 days for reading the topic, practicing, and keep practicing. Written exam is all about practice. You read the basic guidelines side by side, but you practice daily. Okay. So we have chosen a topic of contraception to discuss today. Because it comes in written exam, it comes at OSCE, emergency contraception and all. So I have put the UMAC criteria for you. You all know that. Can you open your mics, please? Guys, participants. Hello.
Hi.
Yes, Madam.
Yes, Martin, Meher. Yeah. So what is UKMEC criteria 3 and 4? What do we understand by that? Just by the way. Hello? Who will answer? Anybody wants to answer, please open your mic. Are you with me, guys?
It is according to the safety of usage of drugs, contraceptions.
Okay,
You meant
right.
3 and 4 is not suitable in doesn't come under the suitable criteria category.
Yes. Okay, yes, Sanam. So 4 is like contraindication and 3 is relative contraindication, right? Where the harm is more than the benefit. So I have tried to make it a little bit illustrative for you just to revise because this you can make criteria is often confusing, especially for the written exam. So who's going to read out? Somebody wants to read out? So we start with the any stroke, migraine with aura, or transient ischemic attack would be UKMEC 4. And migraine without aura or more than 5 years history will be UKMEC 3. Hello? Anybody will read? Martin?
Okay.
I don't want you guys to sleep. I've also come from work. So wake up. Okay?
Okay.
Just it's revision for all of us. Clear?
Okay, so I should start from the
So,
beginning or
yeah, just mhm.
the UKMEC criteria?
Yes.
Okay. We have
Yeah.
TIA, stroke, migraine with
Yes.
aura,
This will be
and it will be 4.
4. Yes.
Yes. Then migraine without aura, greater than 5 years, history of migraine with aura,
Yeah.
3.
Yeah. So if this is 3. Then cigarette smoking, whenever there is smoking, look at the age of the patient. Less than
Yes.
35, we are not concerned. Okay. More
Okay.
than
Yeah.
35, we have to see how many cigarettes she's smoking.
Okay. Greater than
Come on.
or equals to 15,
Yeah.
15 stick
Yeah.
cigarettes.
This will be,
Yeah. 4.
yeah.
Then less than 15 is 3.
Yeah.
Okay.
Next,
Then this
for the
is
cardiac
it
conditions.
cardiac
Yeah.
activity? Yes.
Yeah.
I don't
This,
atrial fibrillation, I think.
yes.
AFib. And what is PH? I don't know.
Pulmonary hypertension,
Okay.
subacute bacterial endocarditis, ischemic
Ischemic
heart
heart disease,
disease. Okay. And
cardiomyopathy with impaired
with
cardiac function.
impaired cardiac function.
4.
Right? This will be 4. So remember.
All right.
And multiple cardiovascular disease, yes. What are
Risk,
the risk
risk
factors?
factors.
Anybody
Maybe
who will tell us?
hypertension, diabetes, obesity.
Yeah,
Yeah.
yeah.
No.
Smoking. And
Smoking,
one more.
yes.
There are five risk factors.
Yeah,
Which is the
family
5th
history.
one? Dyslipidemia. Okay.
Dyslipidemia. Okay.
Yeah.
Then
Right.
blood pressure greater or equals to 160 over 100. Vascular
Yeah.
disease is considered 4.
Mm.
Then
I just try to summarize because in the FSRH, the systolic is written separately, diastolic is written separately. So remember, systolic 160 or more than 160 will be 4. Diastolic similarly 100 or more will be 4. Anything less than that, but not normal, will be 3. Also, adequately controlled hypertension is 3. Yes, next.
Then greater than 140 to 159.
Yeah.
Systolic greater than 90 to 99. Diastolic. For adequately controlled hypertension is classified as 3.
Yeah.
Okay. Then for liver problem, hepatocellular adenoma, carcinoma, severe cirrhosis, 4. Acute hepatitis, 3.
Yeah.
Then
we have other conditions 4, which is antiphospholipid antibody syndrome.
Yeah. VTE. Current or
VT
past
current or
factor.
past. Yeah.
But okay. Protein S, protein C, antithrombin deficiency, prothrombin mutation, major surgery of prolonged immobilization is 4.
Yeah. And 3?
Relative with VTA age less than 45.
Yeah, because there's
Okay.
confusion
Family
regarding
history.
family history. Yeah, so if
uh,
family history, see, first degree relative only matters, not the second or third, not the grandmother. Okay, so mother, brother, sister, father, first degree, and
Is it
then we
for
see the age.
hormonal?
Sorry.
Is this for hormonal contraception or for all? Because
Yeah, this is you can make criteria is basically for the combined hormonal contraception, for
okay,
the
COC.
combined pills. Yeah,
Okay.
CHC, combined
Okay.
hormonal contraception, not only pills, we have patch, we have ring. So
Okay.
that is why usually if you notice it's written CHC means combined hormonal contraception, which would include COCP, it will include CVR, which is combined vaginal ring, and CTP,
Mm,
which is combined transdermal patch. Okay.
mm,
So
mm,
first degree relative, if it is at a younger age had thrombosis, this will be leukemic 3,
mm.
right?
Yes.
Moving on, some other factors which we shall remember. I tried
Okay.
to summarize it.
Good,
So
man.
anybody
Okay.
else? Another volunteer, please? Hello? Who else will come forward?
Yes, ma'am.
Yes. Nahid?
So remember these. My name is Saima.
Saima, yes. So for we were doing UKMA criteria as
So
you
ma'am,
saw 4 and 3. There are other conditions
yes,
like
ma'am.
B is for
BMI is
BMI,
more than 35.
breastfeeding, breast cancer. Okay.
Yeah.
Yeah.
Yes, ma'am.
Yes.
Past history of undiagnosed BRCA. 1 is 3. Breastfeeding.
Yeah.
0 to
So
less than 6
current breast
weeks.
cancer will be 4. And if there is past history of breast cancer or there is some lump which is not diagnosed or she is BRCA1 gene mutation positive, this would be 3. Correct?
Okay, ma'am.
Agreed?
Yeah.
Yeah, okay.
Regarding
Mhm.
breastfeeding, if it is 0 to less than 6 weeks postpartum, then it is 4. If it's
Yeah.
more than 6 weeks to less than 6 months, it is 2.
Mhm.
If it is more
Yes.
than 6 months, it is 1.
6 months or more.
Yeah.
Yeah,
Okay.
so I think there's a mistake here. Here there's a mistake. So less than 6 weeks to less than 6 months. No, there's no mistake. It's fine. Less than 6 months here.
That's
See, it is 2.
yeah.
When it is more than 6 months or more than 6 months, this will be 1. So in postpartum, see whether the woman is breastfeeding or not breastfeeding. If breastfeeding, we need to see the duration.
Okay.
Okay.
Yeah.
If breastfeeding
Non-breastfeeding.
then we have to see the duration. So,
Okay.
how many weeks is postpartum? So, early postpartum period would be 4. And then it comes to 2, and at 6 months or more, it will be 1. Yeah, if she's not breastfeeding, then
Then any can be given.
yeah,
POP, progesterone only pill, man.
yeah.
Desogestrel. If she is breastfeeding.
Sorry.
If she is
No,
breastfeeding, we have
yes, you are right. We have the option of POP, progesterone only
progesterone only.
contraception.
Yeah.
Yes. So,
Yes.
if she is not breastfeeding, then
If she is not breastfeeding, ma'am, then we have the options according to her risk factors we can offer.
yeah.
Combine contraceptive pills or
Hmm.
whatever suits her as per
Hmm.
her risk factors.
Yeah. Yeah. So you have to see the risk factors for venous thromboembolism, right?
Yes, ma'am. Yeah. Yes, ma'am. Risk
So you have
factors
to
may
see if she has, if
VTE
the
risk
risk factors
factors.
for
Yeah.
venous thromboembolism are positive, then
Mm-hmm.
we have to see how many weeks she is postpartum. If she is less than 3 weeks postpartum, this will be UKMEC 4. And if it is 3 to less than 6 weeks postpartum, this would be UKMEC 3. Clear,
Yeah.
everyone? So for non-breastfeeding, if she is breastfeeding, we see the duration for the postpartum. And according to that, we categorize. If she is not breastfeeding, then you have to look if she has any risk factors for venous thromboembolism. See, for what we are worried? We are worried for venous thromboembolism because in postpartum patient, there is more risk. So that is why we have to assess the patient. So if there is any risk factors for venous thromboembolism, then and it is less than 3 weeks, means less than 21 weeks, then combined hormonal contraception will be UKMAC4. If it is 3 to less than 6 weeks, it will be at 3. So until 6 weeks, it will still be a little bit higher risk if she has risk factors for VT. Clear?
Yes, ma'am.
Yeah. And if there are no risk factors, then even then, until 21 weeks, there is more risk. So that is why it is UKMAC 3. So after 21, 21 days, until 21 days, it will
Yes.
be
Yes.
3. So
Mhm.
after
Okay.
3 weeks, until first 6 weeks postpartum, it will be 2. And once she will be 6 weeks postpartum or more, it will be 1. I hope it's clear for everyone. Clear?
Yes.
Yeah, okay. Okay. So now I want volunteer from those who are appearing for OSCE in February. Who all are appearing for OSCE in February? Hello, guys.
Inshallah.
Inshallah, who's this?
Shayma.
Shaima, would you like to attempt this scenario? We'll
Okay.
give you 10 minutes. Hmm? Yeah, very good.
Um,
Oh, what happened to the
okay.
screen share? You can see the screen?
Yeah. Yeah.
I can't see.
Yes,
You
Dr.
can see?
Khawar.
Yes, it's
Yeah.
visible.
You all can see, right?
Yes.
Oh, I don't know why I can't see. Okay. Okay, so I will put a timer for 10 minutes. So I'll be your role player. Dr. Shaima, can you hear me? Yeah, okay.
Yes. Yes.
Yes, okay. So let me open my video. Mm. Mhm. Why my video is not coming? Dr. Musarat is already there. Welcome, Dr. Musarat. I didn't see you before. Hello.
Thank you, Dr. Khawar. I am here.
Okay, Dr. Shaima, you also open your video. Dr. Musarat, you want to be the role player with Dr. Shaima?
Okay, Dr. Khawar.
Yeah, good, good. Okay. Dr. Shaima, open your camera also.
I wasn't ready to open my video. Okay. One minute.
Hmm?
Okay. My camera.
Okay.
I don't know something with my camera. It's not open.
Okay, doesn't matter.
Okay, I'll try.
Dr. Musarat is your role player, and I will start the timer now. Okay? 1, 2, 3, go.
Okay. Hello, I am Dr. Shay, one of the doctors here in the clinic today. So can I check your name and age, please?
Yeah, doctor, I am Annie and I am 18-year-old.
So can I call you Ellie?
Yeah, it would be okay.
Okay. So Ellie, understand that you've came today because you want emergency contraception. Is that right?
Yeah, doctor, actually, I want morning after pill.
Okay. I totally acknowledge this. Do you have any other concerns, Ellie, that I can address today?
Um, no, doctor.
Okay. So Ellie, if it's okay with you, could I ask a few questions before?
Yes, please, doctor.
Okay, then I will involve my consultant in your management and I will give you some written information about emergency contraception and I will
Mm-hmm.
attach you to some groups. Okay. So Ellie, could you tell me when was your last period?
Doctor, exactly, it was 12 day before.
12 days. Okay. And is it regular?
Yeah, it's very much regular. Usually up and down by 1 day. Otherwise,
One
regular.
day. Okay. And are you using any contraception at the minute? Any birth control?
No, doctor, I'm not using any regular birth control pill.
Okay. I just want to reassure you, Ellie, that all that we'll discuss today will be confidential between us, okay? So I may need to ask some
Yeah,
personal
doctor, I
questions. Is
don't
that
want
okay?
my parents to know about this.
Okay, okay. No one will be no, and I will even if you don't want your GP to know, that's all right, okay? Nothing will leave
Okay.
what we will discuss today between us, okay? So, Ellie, could you tell
Thank you,
me
doctor.
when was okay, welcome. So when was unprotected intercourse, Ellie?
Doctor, day before yesterday, I went to a party. It
Okay.
was with many friends, and
Mm-hmm.
there I went with this one new guy, and it happened there. Actually, I was not mentally prepared that it would be happen. So it was some accidentally happened. I don't know too
Okay.
much about that guy, and that's why I need morning after pill.
All right, Ellie. I just want to make sure that everything is okay and you are safe. So was it consensual?
Yeah, doctor, it was.
Okay, okay. And was a condom involved? Did you use a condom?
No, doctor. It was actually unplanned. That's why.
Okay, okay. And in this cycle, were there other any other unprotected intercourse happened in the cycle?
Yeah, doctor, I had 3 day uh, before that event with my regular boyfriend.
And did you take anything? Did you take the morning after pill or use anything?
No, at that time I thought this was a safe period, so I didn't take any morning after pill after that.
Okay, okay. And so, Ellie, do you have any tummy pain, any discharge from down below?
No, doctor.
Okay. And do you have any medical issues you're taking any medications for?
No, I'm not taking any medication.
Okay. And do you have any allergies?
Yeah, I'm allergic to seafood.
Okay, I'll note that down. Thank you. But you don't have any drug allergies?
No, no.
Okay. And so, okay. And so, have you taken the morning after pill before?
Hello, Dr. Masared.
Hello?
Yes.
Can you
Have you
please ask
taken?
the student to speak loud? She is not audible.
Okay. No, doctor, I never took morning after pill before.
Okay, okay. Yeah, thank you for this. And so, how have you been feeling in the last month? Is everything okay? Do you feel safe and supported?
Yeah, I'm very happy in my life. No problem otherwise.
Okay, that's good. Would you like to add anything?
Would you like to ask anything else, doctor?
I may need to ask you some other information if that's okay, maybe a bit later on. Is that all right with you?
Okay, no problem.
If I need. Okay. So your last unprotected intercourse was yesterday, as I understand. Okay.
Doctor,
So
it
and
was
you
day before yesterday.
on the day before yesterday, sorry. And today is
Okay.
day 12 from your last period. Is that right? Just to
Yes.
confirm. Okay. So that was on day 10, but you had unprotected intercourse 3 days before this. This is what I
Yes.
just want to summarize. Yeah. So the first one was on about day 7, and the second one was on day 10. Is that right?
Yeah, I think so.
Oh, okay. So usually emergency contraception, Ili, we have three options we can offer you. Usually,
Mm-hmm.
in a regular cycle of 28 days, the egg is released from the ovary on about day 14. So, am I clear until now? Are you following me?
Yeah, doctor.
Okay. So, we have two types of pills and a device which is called the copper coil. So, am I clear until now?
Yes, doctor.
So, you prefer the morning after pill. This is what I understand. Would you like me to talk about the other options, Illy?
Yes, please tell me. Then it will be easy for me to decide.
Okay. You, Usually, the two types of pills they act on the egg before it's released from the ovary, so they are effective before day 14. We have two types. One is called Levonel, which contains a type of progesterone hormone. Okay, it's called which is called levonorgestrel. It's usually taken. I'd
Mm-hmm.
like to ask, do you know your weight or your weight height ratio, Ellie?
Doctor, my weight is 80 kg.
Okay, okay. Because this pill, it usually the dose depends on the weight. So maybe we'll need to give you two tablets instead of one tablet, okay, of this tablet.
Mm-hmm.
And you don't have any medical problems, either asthma, any medical problems. That's what I just want to make sure of, right?
No, I don't have.
Okay, okay. So this is one option. This works up to 3 days or 72 hours of the unprotected intercourse. Okay, this is called the morning
Mm-hmm.
after pill. So we may need to offer you two tablets. You may have sickness after taking it, and if you throw up within half an hour or an hour, you may need to repeat the dose. So am I clear until now?
Okay. Okay.
Okay. The other type of tablet, it's called ELA1. It's allopurinol acetate. This is the scientific name. It's taken one tablet, and it works up to 5 days from the unprotected intercourse. And it's effective
Mm-hmm.
also before release of the egg. So am I clear until now?
Yes, doctor.
Okay, but usually because your weight it's a little on the higher side, so it may not be that much effective for you, Ali. So are you still following me?
Okay.
The third option, we can offer you the copper coil. This is a minor procedure. We can insert it. It's inserted into your womb. If you can see from this drawing, this is your womb. It's a T-shaped device. It's inserted inside the lining of the womb, and it prevents the egg
Okay.
and the sperm meeting and being planted inside the womb. And if you would like, you can keep it as a long-term contraception on the long run. On the long run, okay? So you can remove it
Okay.
after your period or you can keep it for a long term. But there are some
Mm.
risks. You may feel some discomfort. We'll give you a painkiller. There are 1 in 20 women who the device comes out of the womb, which is called expulsion, and there is a very rare um, chance that there may be a hole in the womb, which we call perforation. This is a very rare risk. And in all of these cases,
Really?
Ellie,
No, doctor, I
whatever
don't
your
want this.
Okay, okay, I understand this and I respect your wishes. In any option that you choose, Ellie, if your period doesn't come for 3 weeks after the unprotected intercourse or 1 week after the date that it should come, you need to do a pregnancy test. So, are you still following me?
Okay.
Okay,
Um,
and
but doctor, I came here for the morning after pill, and even if that I will get pregnant. So what is advantages of taking this pill?
Time is
I
up.
will do. Okay.
Thank you, Dr. Shaima. Very good. So,
Very well done, Dr. Sharma.
good time. Well
But
done, Dr. Shaima, because this was just by the way, randomly. So, very good effort. Yes, Dr. Masarat, we'd like to hear from you, your feedback.
okay. Dr. Sharma, first of
Come,
all, I
बेटे
really
प्लेट साफ
congratulate
करें.
you. It was very good attempt, especially this was unseen, unknown, and
Yeah, well done.
you were very good. You almost covered.
Hello?
Am I audible, Dr. Khawar?
Yes, yes.
Okay. Um, there were few mistake, Dr. Shaima, that I want to mention you. First of all, you reassured the confidentiality a little bit late. She is young girl, and she told you she don't want her parents to know about that she is sexually active. Then you reassure the confidentiality. You should reassure her in the beginning. One more thing is that she was telling you that this was not with her regular boyfriend, with some random guy. So it means you should advise her against the sexually shared infection. You asked about the history of the sexually shared infection, but you did not advise her about the use of the barrier method regularly. And the most important thing is you did not ask about the obstetrical history. Maybe she get pregnant again, or there is history of the miscarriage. Smoking, I think you did not ask. And
Yeah. Yeah.
family history, I think you did not ask. Family history is also important. And regarding the weight, I think 80 is not the cutoff, it's more than that. Okay. Anyway,
Um.
you prescribe her contraceptive pill, and you advise her to come back if she will miss her period. That was really good attempt. At the end, give the patient information leaflet and save sex advice and involve the consultant.
Yeah.
Thank you,
I
Dr.
wanted to
Shaima. I am
say
really
thank you.
happy
Thank
we
you,
Besides,
Dr. Sharma. There
Ellie.
is
Yeah. I wanted to say it at the end,
feedback
but I didn't have time
slide.
to.
I want to, I'm so sorry. I don't know what has happened today with me. Mm, you
Dr.
can see
Khawar,
the slide of you.
Dr. Khawar, I want to add something because the BMI
Yes,
is the
sure.
very important in the emergency contraception.
Yeah, yeah. Yes.
They have written about that one. We have to double the dose because their effectiveness is
Yes, you
decreased.
are right. Yeah,
Because,
I agree with you.
because he
BMI
is
is not important in emergency, it's not.
yes,
So,
and also there is a vomiting and the nausea. Also, if she has a nausea and vomiting, she has to take the dose within 3 hours if she has
yes,
that one.
within 3 hours, if yes, actually, uh,
Yes, this is. But
again,
she
I'm
done
having problem with the,
that was mentioned by Dr. Shaiman that if you will
we
so
have a slide
take
for
the
the feed checkpoints. I'm just don't know why there's some problem again with the screen sharing today. Yeah, here we are. So maybe the you can see the screen now. Mm,
Screen is there, but the slide is only stuck. That emergency contraception and
yeah, yeah,
CNAS.
yeah. We go to the next
No
one.
more.
Yes.
Next is not coming.
Yeah. Mm, we can check over here. Commands. Yes, it's able to look at it now.
Dr. Khavar, please tell the key
Yeah,
without
I'm
even
telling.
slide note.
Yeah, it's okay. So I will read out for you. 1 second. I'm trying if we can fix this. Okay. So key points to remember for any emergency contraception, your introduction agenda was fine. Then first of all, as Dr. Musharrat has very rightly pointed out, that ensure confidentiality. Okay. And then when you are asking about the act, like unprotected sexual intercourse, you have to do some signposting before you ask. You very rightly asked about the sexual act with whom, whether it was consensual or not, especially girls 18 or younger than 18, 16, 15, 14, you can get in the exam scenario. Any previous episode in the current cycle, you also asked, that was fine, regarding the menstrual history, LMP, whether she was using any contraception or no. So history of contraception and history of use of condom or barrier, because this is protection for sexually shared infections. Also, you asked about the history, and as Dr. Musharrat has mentioned, obstetrical history, whether she had any previous pregnancies, any pregnancies in the past, any termination of pregnancies, were there any complications. Then ask about the HPV vaccine. And if the woman is like above 25, then ask about the smear. Smear history is very important in all the cases. Complete rest of the history, you will ask about allergies, medication, especially allergy to nickel, and history of clots, migraine, because we need to rule out contraindications for combined hormonal contraception. Because we will also provide her emergency contraception, but discuss the ongoing contraception as well, because very likely she will continue the sexual practice, so she needs to be protected from unplanned pregnancies. So personal and family history, asthma history is important too, because it's a contraindication for ulipristal. So then you explain the options. So now how do you explain the options? You have to, for each option, you have to tell, like as you very rightly said, that there are pills, then there's mode of action, success rate. So keep in mind, if a patient, for example, if this patient is epileptic and she's using anti-epileptic, so keep in mind the enzyme-inducing drugs, keep in mind the contraindications. So if she chooses pills and if she feels sick and she vomits within 3 hours, then she need to repeat the dose. Okay. And then you have to instruct her that the next period may be delayed. Even if she's not pregnant, period can be delayed. So if the period is delayed for 7 days or she doesn't have any period until 3 weeks, then she need to do the pregnancy test and then report to us. Also advise her for condom, barrier, use of barrier for future to protect against STIs, and discuss the ongoing contraception. Okay. Clear, everyone? Any questions so far? Hello?
Yes, clear. I just need to organize my
Yeah,
my
no, you
ideas. I
did
just
very good attempt, because this is not a live session for the teaching session. This was just by the way. We wanted just to practice and just to have a glimpse of what we are going to do in the upcoming sessions. That is why, okay? So I wonder why we can't move forward. So there was one we there is slide about the missed pill as well. Let me stop slide sharing and start again then. Just 2 or 3 slides are left, then we will take question answer session and we will close. We'll zoom in again to find out the solution for this one. Yeah. Now is it okay? So this is what I've told you already. Key points to remember. You can have a quick look, all of you. But this will go into recording, and I think it will be available on the website as well. Now coming to the missed pill. So just a quick revision for the missed pills. Anybody wants to read? I just want all of you to stay involved. Dr. Abira? Sumaya? No one?
Madam, may
Yeah. Who's with me?
I?
Sorry? Yes, read out, please.
So,
Hello. So I will just briefly tell you, if nobody is interested, that rule to remember for the missed pill, because
rule
hello. Your
Assalamualaikum,
voice
madam.
is
I can read if you
Walaikum
want.
salam. Yeah, it's okay. Yeah, we can hear you clearly now. Yes, you can read.
Rules of mispill: two or more CHC pills are missed. The EC rules apply if unprotected sexual intercourse occurs in first or week one. Uh, extra one week precaution: omitting pill-free interval if pills were missed in week 3. In case of progesterone-only pills, rules apply if more than 3 hours of Seraject or 12 hours for DSG, extra precaution for 48 hours. Emergency contraception if unprotected sexual intercourse occurred after the missed or delayed pill and within 48 hours of restarting the pill. Clara, estradiol valerate, starting 3 mg, dropping to 2 mg, then 1 mg. And
Because Clara has different, sorry to interrupt you, Clara has a different concentration according to the weeks. That is why it has a different pattern. Okay?
Yes. Thank
The
you.
doses, the concentration keeps on changing, na? Yeah.
Yeah.
Okay.
Dynogest, day 3 to 24, start as 2 milligram, increase to 3 milligram. And mispill rules apply if late in taking off more than 12 hours. Then day 1 to day 9, emergency contraception pill plus condom for 9 days, and then take mispill if the mispill. And 10, if it is on day 10 to 25, then only 9 days use condom if take if mispill in day 10 to day 17. And finally 24 to 28, there no condom is required or emergency contraception is required. Only take mispill of day 25 and 26.
Okay, so I'll try to simplify this. Remember, when we say missed pill, if the pill is missed for not taken for the 24 hours from the time it is supposed to be taken. For example, some woman is taking a pill at every day at 10 p.m. So if today she has not taken, yesterday she took. So after 10 p.m. today, if she has not taken, this will be missed pill. So there is a 24-hour time period for the combined hormonal contraception. So a simple rule is that we need to see when we have to give the emergency contraception and additional precaution, because the pills we know are not effective immediately. So it should be taken consecutively for 7 days to be effective to protect from pregnancy. So first of all, if one pill is missed and the time period is like it's from 48 to less than 72 hours, this is according to the new guideline. And in the first week, because first week she has just started the pack, so they will not be 7 completed days. So if she's missing the pill in the very first week, then of course she is at risk. Similarly, if she is after hormone-free interval, like in the week 1 after hormone-free interval, which means that the first week she is missing, then she should take the pill as soon as possible and continue the pills in the same manner until less than 72 hours, which means 3 days. So if more than 72 hours has passed, then she has to take the emergency contraception, and also she has to take extra precautions for 7 days, which is or no. And you will also tell these patients to continue taking the remaining pills in the similar manner and do the pregnancy test if she is not having her periods. Clear? So if one pill is missed in week 2 or week 3, after the hormone-free interval, yani in the second week or third week, if she is missing one pill, then emergency contraception is not required. Just we provided she has taken all 7 days pills consecutively, not missed the previous ones. So whenever the patient is coming or there's a scenario that missed pill, you must see that previously she has taken regularly or no. So if she has been taking regularly consistently for the previous 7 days, then in the second week or the third week, missing one pill, we are not concerned. There will be less risk. So there's no need for emergency contraception. But if she has missed 2 or more pills and time has passed for 72 hours or more, then we need again to give contraception. Uh, in even in the first week, still she will, if she has taken pills regularly in the 7 days. So second week, third week, she will still not require. Right? Dr. Musara, do you agree with me?
Yes, Dr.
Hello?
Khawar, I do.
Yeah. So you have to see if she has been taking previously the pills regularly. So now we come to our last session. So we need now volunteer from the written group because we have 2 MCQs for them. So who will volunteer? One girl can attempt or candidate can attempt question number 1, then second one can attempt question number 2, then we'll take the question answers and then we'll close. Okay. So yes. Yes, please. Quickly. Dr. Binish, I can see you have joined now. You are in the written group or the OSCE group? We'll be seeing you more often because today is the first day, first interaction. Then we will be familiar with all of you. Right? Anyone from the written group? Hello? Where's Martin? Dr. Martin? He has left?
I should read?
Yeah.
Okay.
You are for OSCE or written?
No, written.
Yeah. So please attempt question number 1. It's easy.
Okay. A
Very
woman
easy.
taking lamotrigine is using the CTP. Which one of the following statement is correct?
CTB is combined transdermal patch. Right?
Okay. Okay.
Yeah.
Lamotrigine is a liver enzyme inducer and will reduce the hormone level. Serum lamotrigine level can be reduced by CTP. Lamotrigine levels are unchanged. The benefit of using CTP with lamotrigine usually outweighs the risk. I think A is an enzyme inducer.
Which statement is correct?
A.
Lamotrigine is an enzyme inducer?
Yes.
Are you sure? Or is it the opposite way?
Well, the combination
Anyone else, please, like to answer?
Yes,
You can read
please.
the stems again. Yeah.
Yes, I think it's B, the correct answer, which is serum lamotrigine levels can reduce by combined transdermal patch. I think
Yes.
yes, correct.
Yeah, you are right. Yeah, correct. So who will, Dr. Martin, and lamotrigine is the only anti-epileptic who is which level is affected by the combined hormonal contraception. So it reduces its absorption, so there is more
Efficacy.
chance of having seizure. Efficacy of the drug will be affected by the combined pill. It's vice versa. It's not like others, you know, carbamazepine and the drugs, they are enzyme-inducing drugs, will reduce the efficacy of the pills. But here it's opposite, okay?
Okay.
So question number 2, who will attempt? Quickly, guys. Anybody can attempt. Or Dr. Martin, if nobody, then you are the volunteer.
Okay. Which one
Or
of the
anyone
following?
else want to? Second question. It's a bit tricky.
Okay. Which one of the following statement is correct regarding a
Is
woman who wants
incorrect.
to...
Is incorrect.
Okay, it's incorrect. Yes, regarding a woman who wants to switch from combined hormonal contraceptive and is on day 6 of her hormone-free interval. If she has a copper ICD inserted today, no additional precautions are needed. If she starts a POP today and has not used OPSI in the hormone interval, 2 days of additional precautions are needed. If she has a subdermal implant inserted today and has had OPSI in the high hormone, she should restart her CHC for 7 days. If she has a levonorgestrel IUCD inserted today and has not had OPSI in the hormone free, no additional precautions are required. Which one is incorrect now? She has a subdermal implanted in that and has OPSI in the, she should restart her COCP for 7 days. She starts it today and has not had it in this. 2 days additional precautions are needed. I think B.
Dr. Musrat will guide us.
Okay.
Yes,
Thank you,
Dr.
Dr.
Musrat.
Khawar.
Welcome.
Am I audible?
Yes.
Yeah.
Okay. It's a little bit tricky question, not simple one. Anyway, Dr. Khawar has already told us that pills take some time to be effective, and it is 7 days. Okay. And if patient has already taken the pills for 7 days regularly, so she is in the safe. And if you want to switch to some other contraception in in second and third week, no additional contraception will be needed. And if in the one or second day of the hormone free interval, also no additional contraceptive will be needed. On the other hand, copper IUCD is immediately effective as soon as inserted. That's why it's used as emergency contraception as well. All other hormonal preparation, they will take some time. Like combined pill will take 7 days, POP will take 2 days, Clara will take 9 days to be effective. So if we will keep in mind these two things, the option D is incorrect. Patient has to take contraception, or she will continue the combined hormonal pill for the next 7 days, or additional barrier method if LNG-IUC, the LNG-IUS will be inserted.
Yes.
Rest of the three options are okay.
Thank you, Dr. Masara. Clear to everyone? There are FSRH guidelines and they are very lengthy, but there are some recommendations for missing pill scenarios. There are some recommendations for LARC and for combined hormonal contraception. So I would suggest all of you, we still have time. We are just starting the course. So you cannot read it all at one setting. So for example, just keep every day one section you revise. For example, today you read the missing pill guideline, then you read the combined, then you read the postmortem, because you need to keep on revising. Otherwise, it creates confusion, especially for the written exam, SBS. So first read, make your own small notes, maybe small, just the points, bullet points you can write for each one, the way you can remember. Like for UKMEC criteria, I did some illustrative, and this is my way always. I'm trying to remember like this because you cannot just memorize the whole charts. It's very difficult. Okay. So then these concepts will be clear because also practice from the practice books. But first, I would say read the guideline because there are some updates. There are some recent updates regarding the missing pill. Also, the one I told you for 48, 72 hours before. Previously, it wasn't there. So since last 2, 3 years, they have updated the guidelines. So download the guidelines in your computers, laptops, mobiles, whatever, and just read the recommendations. Okay, guys.
Okay, thank you.
Right. So any questions, anyone, one by one we can have, or if there are any questions in the chat box, I will have a look at that to see if somebody has any questions.
Madam, I have a question, please.
Yes, you are
I am Dr. Taiba.
Taiba, yes, dear.
So, madam, I actually cleared my written exam in September 2023, and it's been a long time now. Although I did my MRCOG exams in between, but still I haven't been through Irish guidelines since then, and I'm very worried that I haven't just even started reading anything yet. And just in last week, I subscribed to the course, so I'm so confused at shall I go for this attempt? Like I'm not very sure. I'm still worried that I have enough time to go through all the stuff.
Are you working?
Yeah, I'm working. I have done FCPS as well, and I'm doing as a consultant in.
Then you
Yeah.
don't have to worry. You're working as consultant, you are FCPS, you already have the background knowledge. The only thing is that you have to practice. I would say go ahead, and this exam is very doable. We hardly, like, I think more than 90% candidates, especially those who have clinical experience, they pass because this is just like FCPS on FCPS pattern mostly. They don't go too deep, but of course, you need to have a good grip on the subject. For example, if there is endometrial hyperplasia, the examiner can take you to endometrial cancer, you know. So you should
Yeah.
need the topic. You just need to revise. So I would say that stay with us within the course. And
Okay.
there is a Telegram OSCE group already we have started last week. So there are some stations there. As I told you, OSCE will have like 7 stations. One will be labor ward prioritization. So we will do good practice for labor ward prioritization, but not now. Closer to the exam, we will do. And I don't remember who is taking the labor module, but I think it's a good idea that we can take labor ward separate because you need to practice to speak. And rest of the stations I'm covering in the OSCE group, almost maybe 100 recalls we will able to do. More than 50 we'll definitely do, maybe around 60, 80, because already we have covered, I think, 7, 8 stations, and today I posted 2. So what you should do is that try to follow the OSCE, the Telegram group. Okay, so the stations which we have already started last week, you can cover one station every day, post it, and I will give you the feedback. Doesn't matter. And also, you'll have to, in the beginning, you'll have to work a little bit harder. So take at least 2 to 3 hours. There is side by side another Telegram group for study material. So related, for example, I posted twin monochorionic twins today. So I have also in the study material posted a leaflet, guideline, Irish guideline, RCOG guideline. So this will save your time to go on the websites and search for the related literature. So this will be easier for you. And I
Sure.
think it's never too late. Start now because giving long gaps is difficult, and also it's not sure you get the seat for the exam or no. There's also uncertainty about these exams, both for part 3 and for MRCPI as well, for MRCOG as well. So sometimes you are very
Yes.
well prepared, you don't get the seat, then there's lots of disappointment. So I would say that don't waste time. And take out at least 2 to 3 hours daily, 2 hours maybe from now for your study, and find somebody with whom you can practice. That will be excellent. Otherwise, you can just put your audios, okay? And for everyone, please, there is very, very little participation in the Telegram group, and I think this is you are not doing good to yourselves. You have spent lots of money, investing time, everything. And so this is just the appropriate time now. If you will delay now, I think it will be very difficult. You will panic in the end. So please
Oh,
don't be lazy. This is for everyone, whoever is listening from the OSCE group. I would encourage all of you to, I expect maximum participation from all of you. Okay? Clear, Dr. Tema?
sure. So
Anything
much.
else?
Thank you so much.
Yeah,
Thank
and
you.
good luck.
Thank you.
Good luck.
Thank you so much.
Any other questions regarding the course or exam or anything? If no, I think then we can end. Hello? Anybody has any queries, please? Okay, dears, then. Thank you so much.
Thank you so
Thank you.
much.
Thank you so much.
Thank
It
you.
was very nice to have you, and I hope some things are clear regarding people sometimes writing on the Telegram group that we don't know. So I think you have orientation now. If there are any doubts, please ask me now.
Yeah.
So we'll see you in the regular courses now. We are starting, okay? And Telegram groups are already there. Participate maximum. If you need any guidance regarding how to manage your time or anything, I'm there. Dr. Musarat is there. Dr. Shazia is also our mentor, the very well known and very experienced, mashallah. So you have, I think, lots of help out there. If only you want to help
So,
yourself. Okay.
yes, one question, please.
Right, Dr. Musarat? Yes.
Yes. So, other than posting on the Telegram group, how will you start the classes? Like, will it be weekly sessions?
Yeah,
Right?
there is a gap of week or 10 days. We will start the OSCE session. I've already told you guys, because there was a little bit change in the schedule. That is why it's
Okay.
late, but I think the team will share today with you because if it is, I think, finalized now. Let me open and I will tell you exactly. We are going to start.
So the active candidates will be presenting in every session, right?
See, so this we are going to start from 26th November. First session will be taken by Dr. Shazia. It is about antenatal care and early pregnancy. So what we did in the Telegram group that first, because antenatal care and early pregnancy is a big module, like there are lots of topics in antenatal care. So I tried to cover few topics initially, and now I'm putting today I posted two topics. So every day you will have two. So we will cover certain topics from the same module, which we are going to have a live session on 26th, which is Wednesday at 3 at if I'm not wrong, 3 p.m. GMT. Okay. So in this session, the
Okay.
participants will have usually what Dr. Shazia is doing that she is taking one long case. Anybody she will present because it's not possible everybody to present for 25 minutes long case. Then it will be for hours and hours the session. So she is taking one person can present the long case and rest are doing OSCE stations 10 minutes each. So that for 5, 6, 7, how many candidates are there, the topics are covered. Okay. So next,
All right.
after that, on December 2nd, I'll be taking maternal medicine. So whatever topics from maternal medicine I'm putting in Telegram, I will not repeat in the live session. We will do different topics because again, maternal medicine is a long module. So that you can you can practice maximum topics. You got my point?
Yes.
Am I clear
Okay.
so far? So
Yes,
stay
madam.
glued with the programs. Similarly, for the written schedule, I think the first session is also by Dr. Shazia and it is on 28th of November, early pregnancy. And next, I'll be taking, inshallah, on not 4th of December, probably 3rd or 5th, which is Wednesday or Friday, on gynae and surgical emergency. This is about the written group. Already written Telegram group, Dr. Musarat is running. Right, Dr. Musarat, can you want to tell something about your, has she left? I think she's left. Hello? Okay, girls, clear? Girls and boys, doctors.
Yes.
Any question you have, Dr. Martin or anyone else?
No.
Okay, so we'll be meeting frequently in the live sessions. Best of luck for all of you. And make your
Thank you.
timetables if you have not already done. It will help you, at least even if you are not able to achieve your targets, daily targets, write down your weekly targets, write down your daily targets. Okay. So if you're not able to achieve, no problem. It happens with everyone, but still it will keep you going and keep you motivated. Okay. These 2-3 months is the hard working time. After that, once you will have your degree, you will be flying high. Okay.
Inshallah.
Good luck
Thank
to all
you.
of you. And thank you so much for your time.
Thank you, Madam. Allah
Bye bye.
Hafiz.
Allah Hafiz. Bye bye, everyone.